Sure, thanks, Mario. So my name is Nick Edwardson. I am an associate professor, and I'm currently the MHA program coordinator. Today, we wanted to talk about the program, provide some program overviews, discuss the curriculum, overall look at the trajectory and the expected Bureau of Labor Statistics data related to the MHA degree in particular. And then we'll transition back to admission requirements and look at have a brief Q&A session. So next slide, please. So I would not be a good academician if I didn't start off with a pithy quote, because that's what we do very, very well. It's the following from Atul Gawande: research on our healthcare system can save more lives in the next decade than bench science, research on the genome, stem cell research, cancer vaccine research, and everything else we hear about on the news. This, of course, he's talking about research. Now, MHA programs, we're not turning you into bona fide researchers, but we are equipping you with the skills necessary to run basic analytics, to look at your specific service unit, whether we're talking about running and managing a specific service line within a larger healthcare organization, or we have many students who end up running clinics and then ultimately being promoted up to running large health organizations and then ultimately even health systems. And at that point, when you start to run some of the analytics and understand how the organization is moving, you really do have the opportunity to do what Dr. Gwande is referring to here. Next slide, please. What we do specifically is we focus a lot on the IHI quadruple aim. Of course, this was recently up until recently the triple aim, and we've now added the care team well-being, specifically with regards to physician and clinician engagement. But we do this via an array of approaches. Obviously, we want to focus on experience of care and population health. For that, we're going to have a lot of focus on data analytics and data visualization. We realize that in this day and age, our clinicians are overwrought, overburdened. We know a lot of the latest research shows how they're just being burned out and they're leaving the industry altogether. We want to help enable them to do their jobs better. And a quality healthcare administrator, a healthcare leader, has the ability to serve as a force multiplier across their organizations, specifically in addressing burnout, but then also in improving patient quality and patient experience through such things as data analytics. But we also acknowledge the local environment that we're in here in the state of New Mexico, and we know that we have one of the most diverse states, and that we are diverse not just racially and ethnically, but we also have a large array of poverty, and we start to think about the socioeconomic status and the socio-political environment of the state. We realize that we've got to not just develop managers and administrators and leaders who are able to do data analysis and show how their organizations are performing, but they need to be culturally competent. So we're going to spend quite a bit of time in the program focusing on increasing the cultural competence and the acumen of the managers to be aware, to make sure that we're delivering healthcare not just to a diverse patient population, but then also our staff and our clinicians as well, who come from these diverse backgrounds. And then ultimately, you also see the per capita costs. Of course, we would be remiss to not have you go through a number of courses that look at payment systems, that look at the health and the finance, healthcare finance and healthcare budgeting systems. So we covered that in our program as well. Next slide, please. So as you can see here, the Bureau of Labor Statistics supports us in saying, look, this is a worthwhile investment for those of you that are considering an MHA. In general, perhaps not surprising, they're expecting quite a bit of growth, 32% between 2020 and 2030 for this particular position. And that has some good face validity, because if you imagine and understand, as the baby boomer generation gets older, needs more healthcare, and hopefully has the resources to spend on healthcare organizations are going to need these bright, new, innovative managers to come in and help run these systems. Over on the left, of course, you can see the renderings for the new UNMH tower that's being built right across the street from our building. We're going to need managers and leaders to populate that building and to make sure it's a success for the community. And you can also see median salary there, a little over 100K, but again, there's large degrees of variance. A lot of the students that come into us, we've got a slide here coming up on that, come with quite a bit of healthcare experience. And for those of the students who are already clinicians, physicians, et cetera, there's a wide distribution of salaries here, but a nice median salary, as you can see here, reported by the BLS. And then even the earners there in the top 10 percentile. Next slide, please. So let's talk about some of the program features of our MHA program. We do have a 48 credit our program that's achieved in 16 courses. You can see those listed here on the right. But before we get into the actual content areas, I wanted to highlight some of these bullets here on the left, specifically this flexible modality. So all of our courses and our program was designed for mid-career professionals. And these mid-career professionals, we acknowledge most of the time work 8 to 5, but we have a lot of physicians and nurses who work different shifts as well. We found a nice, we think, sweet spot of a 6 p.m. start time for all of our classes. And each of those classes are offered both synchronously online and in person. So if you're available to come to campus and you can at 6 p.m., we encourage that. We'll talk about our cohort model there in bullet point 3, but we do have a lot of camaraderie and really value that is built through this cohort model. So we do encourage students to be in person when they can, but we also acknowledge a lot of students based on shift work, or they're from all over the state. Not at all uncommon for us to have students from Arizona, Southern Colorado, and even Texas and the southern part of New Mexico, and they typically will attend all of our classes via Zoom. That said, they're all together, they're synchronous. And then as you can see here, the 6 p.m. start times, and we do have that preferred fall start for cohorts. That's not to say we won't admit you in the fall and then have you start in the spring, but we really do like and encourage the cohort model because we see a lot of value extend beyond the program, post-graduation. We have some great examples of students and this was not obviously taught in any of our classes, but if you recall back during the beginning of the pandemic and there were PPE shortages, we found out after the fact that there were a number of students who had gone through the cohorts, gone through the program in the same cohort. They were picking up the phone and calling each other saying, hey, I've got masks or I've got gloves. Where can I meet you to help hand these off? And that's some of the value that we see in the cohort model. Next slide, please. So our program is additionally flexible, not just in the context of being able to take the classes at a convenient time, but also the speed in which you go through the program is highly adaptable and it's up to you and dependent on your schedule. At the very top here, you can see we do have a few students, not many, but a few students who can fly through our entire program in under 2 calendar years. Now that's not common. And in order to do that, it would be really tough to be a mid-career professional and still achieve this. But like I said, we've had a few actually pull this off. But more than likely, if you're a mid-career professional, we're looking here at either the 8 or the 10-term plan, where you're taking anywhere from 2 to 3 courses per semester. And that's then able to get you in and out of the program in under 3 calendar years. And then, of course, even for those who want to really slow roll this, we allow that. We don't necessarily encourage that, but we have a number of students who are on a nice slow career track, and they're confident that that 11-term plan is an option for them. Next slide. Here's some basic characteristics of our most recent cohorts. You can see the distribution. Again, this is a program that's tailored to train current healthcare administrators and clinicians to become those healthcare leaders who are aware of and able to address cost, quality, and access issues here in the state of New Mexico. So perhaps not surprisingly, a significant majority of our students have at least 3 years of healthcare experience, with a third having over 10 years of experience. But that's not to say also we've got this quarter that come typically traditionally either straight out of an undergraduate program, or they're at some sort of mid-career point where they're shifting into the healthcare space. So that would be that column there on the left as well. But in general, we do try to create a diverse student body for each cohort. So we do like to curate that, make sure that we've got some young students. We've got some students with outside perspectives, with very little healthcare experience, because they bring a different perspective to things. But then also our seasoned professionals. We've had some, nurses and physicians and clinicians come through with, 30 and even 40 years of experience, but they really want to take that next step in their career and become healthcare leaders. And they've done that through our program. And then age, you can see, correlates pretty well there with the same data that you see there with healthcare experience. Next slide. I think this is you, Mario.
All right. Thank you, Nick. So in lieu of all the great things that Nick just mentioned in terms of program outcomes, curriculum, I'm going to give you some additional reasons why you should choose the MHA program. So each year, U.S. News and World Report brings out its graduate college rankings. And we're proud to say that we're currently ranked top 114 in the nation. We're also an associate member of the Association of University of Programs in Health Administration. We're proud to say that we hold a gold status, being a military-friendly school. So we are a top 10 school for veteran support. So this means that if you're active military, veteran, you will receive resident tuition rates, as well as your spouse and dependent. So we are a military-friendly gold status school. Important to note here that we also do take a holistic approach to the application. In the next slide, I'll go over a little more in detail in terms of what we're looking for. But we're looking at the whole application, not just GPA. And of course, we don't require a GRE. So that's a good thing as well. As Nick mentioned, in terms of what's going to be in the classroom, we are going to have a diverse student body and faculty. So, the faculty members are going to be leading experts in the field, as Nick has mentioned and his work shows. But you're also going to have a diverse student body within the classroom. So much like what Nick talked about in those slides, you're going to have, working professionals, students that are doing the traditional route, which adds to the class in terms of discussions and things along those lines. And one of the things we proud ourselves in is that, of course, we do have flexible class scheduling. So the School of Public Administration has been doing this for a long time. We do offer evening and weekend courses. And of course, as was mentioned in the previous slide, you can do the synchronous online Zoom in to a live course and participate in discussions, classroom, discussions, papers, things along those lines. So we do offer flexible class scheduling. We also, now in terms of the MHA admissions requirements, we do have rolling admissions. So that means that you could be admitted all the way up to the term that you intend to attend. But we do have priority dates for financial aid, scholarships, and assistantships. So that date is April 1. Now, in terms of the holistic approach to the application, this is what the admissions requirements are. So we are looking for a letter of intent, 2 to 3 pages. So this piece is really important here because this is where you're going to tell us why you deserve to be in the MHA program. So I asked that, I recommend that you spend some time on this letter of intent. And once it's complete, you upload it into that application. We're also requesting 3 letters of recommendation. So we ask that you provide your recommender's email address. Of course, they're the ones that are going to have to upload the letters of recommendation into the application. So they have to come from the recommender. And when you're choosing your recommenders, you're going to choose, a faculty member, staff member, previous, supervisors or current supervisors, someone that's going to give you a great recommendation for the program. We ask that you dust off your resume, get that updated. You'll also, once you update it, then you'll also upload that into the application. Now, in terms of our program application, you can upload unofficial transcripts into the application. That way, the reviewers are able to see your undergraduate coursework. Now, in terms of the formal application to the University of New Mexico, we are going to require your official transcripts. So from each institution that you've attended. So you could either send it to the PO box that's listed here, or most universities now do it electronically via our parchments or via parchment services, and you can send that to apply@unm.edu. And of course, once you've completed the application, you'll have to pay the online application fee. All righty. So for our international applicants, the program application is going to remain the same, and so is the admissions requirements. So you're going to, of course, provide the letter of intent, 3 letters of recommendation, your updated resume, as well as your unofficial transcripts from each institution. But much like our general admissions requirements, you are going to have to meet the global education or the international admissions requirements for general admissions to the program. So you're going to have to submit all necessary documents to the Global Education Office. We've provided their information here, so you can reach them at geo@unm.edu. If you prefer to call, you can reach them at area code 505-277-4032 to ensure all the admission requirements are being met for GEO. Now, for international and general admissions applicants alike, you can't register for courses until you're formally admitted either through the Office of Admissions or through the International Office of Admissions. Okay. So let's take a look at some financial resources that are available to students. So we do have endowments and assistantships available. We do have the Albert H. Rosenthal Fellowship. So this is an award of up to $1,000 based on academic merit. We do offer graduate assistantships as well. So this is a financial award for part-time work. If you are fortunate to receive one of these assistantships, you can work alongside one of our great faculty members, staff members, just kind of depending on what the office needs. But this is a great opportunity here. For our international students, all international students are considered for the International Amigo. So basically what the International Amigo is going to do is it's going to offer you resident tuition rates. So you'll pay what a New Mexico resident pays in tuition, okay? Now, if you're fortunate enough, if you're an international student and you're fortunate enough to receive an assistantship, you can only use the assistantship because basically with the assistantship, you're going to be paying resident tuition, okay? So much like all our scholarships here at UNM, we're always going to award the higher scholarship, and in this case, the assistantship holds more value. So these dates, of course, these endowments and assistantships, you have to be admitted by priority date of April 1, okay? So at this point, I guess we're going to go ahead and open the floor for any questions that you have. Nick and I will be able to answer any questions. So do we have any questions today?